I'm Thomas. I'm the CEO and founder of Etsimo, and we are already an established company. We offer end-to-end processes for holistic consumer journeys using artificial intelligence and machine learning on top of health and other data. Our cloud-based offering, called the Etsimo Diagnosis Engine, is API controlled, and that makes it possible to support all kinds of use cases and user interfaces on more or less any device. With that, we offer a 360-degree health view that includes reactive, predictive, and preventive health. We have a strategic partnership with both the largest private healthcare provider and the largest insurance company in the Nordics, and we also work closely with the Finnish Medical Society. And on top of this, we have a very strong presence in Brazil. We have in production a patient sorting and demand control solution for COVID-19 for the 21 million inhabitants in the Minas Gerais state. And let me tell you that from first contact to production deployment took just 5 weeks, and that includes a medical certification, medical device certificate for the Brazilian market. So next for us in Brazil is a rollout to the Santa Casa hospital chains, 1,788 hospitals. And our mission is to keep people healthy, and we're also prepared for a future pay-as-you-live world. As you may know, healthcare, and especially mobile health, is being transformed through three converging technologies: AI, always-on health monitoring, and chip diagnostics. And in the beginning of this year, the tipping point before COVID was estimated to come in 2 to 5 years. But due to COVID, the tipping point is already here. And in a study conducted by 2 insurance companies in Finland last year, one of the conclusions was that it's not easy for an insurance company to exceed expectations. Consumers want and expect healthcare and insurance to be connected and to be as easy as shopping online. And the threshold to seek care is a lot lower when you are insured, and therefore over 30% of the visits, the claims payout, are unnecessary from a medical standpoint, and at least 50% of the necessary visits could be handled remotely. So if you use these parameters and take into consideration that remote care is approximately 55% cheaper to produce, you can make a business case modeling like this. The left side of the diagram shows how revenue is distributed right now. The red and blue areas are the total visits or payouts, and the light blue, the overhead, and the green is the margin. And if you can get the unnecessary visits down by 10%, so that would be from 30% to 27%, and 10% of the necessary visits handled through remote care, you will almost double the margin. And this is the first milestone that we have with If, which is the largest health and life insurer in the Nordics. So with our solution, patients can self-diagnose themselves. So we use their medical history and their current symptoms to provide them with a personalized care need assessment. And based on that, we can tell them their care need, the urgency of that care need, and what the next step should be without any human intervention. The basic care paths that we provide, and these are fully customizable, of course, are self-care, asynchronous care, remote care, and face-to-face care. And in all these cases, we collect the pre-information or anamnesis so that the professional can get a flying start. We also use something we call case monitoring to make sure that the patient is recovering. And with this, we can help reduce unnecessary visits. And we can also help you come between the patient and the provider to control both care and costs. And as I mentioned, our API accommodates any use case and device, so we can build user experiences that fit your service design and your current solutions. And through our solutions, we can provide a seamless handover or process between the self-service parts of the consumer and the professional. And when you start using AI on top of data, it becomes a flywheel. And that's, in our case, what data-driven means. And data-driven is also future-proof, which means that it's expandable. So more data leads to more insights, that leads to more data, and so on. And catching up is really hard if you start late. So normally companies expand vertically or horizontally to neighboring segments. And most companies are using artificial intelligence to automate some of their old processes. But I think you should think outside the box, because with AI, you can rethink and redesign your whole business. And the pay-as-you-live world is coming. And the question is, are you going to lead or are you going to try to catch up? So if you're going to lead, we are extremely interested in working with you. And we also do a lot on predictive and preventive health, but I was given just 6 minutes, so that's not enough to get into that. So thank you for your time, and I'd be happy to answer your questions.
Thank you very much, Thomas. I do have 2 questions in the Slido app. The first question is, who provides the necessary medical content, and how do you ensure service and advice quality?
Yes, so first of all, the data that we use is from the Finnish Central Depository. We have a way through the person ID to connect primary care, secondary care, social care, and so on for the whole Finnish population. So our models are built on that, and the clinical quality is assured by our strategic partner, Terveystalo, who has over 10,000 clinicians on their payroll. And we also work closely with the Finnish Medical Society. So I hope that answers your question.
Perfect, good. Thank you very much. The second question I see is, how do you handle liability?
Yes, so liability is something that is really hard to eliminate totally. So that's why we have a way of making it possible for our customers to configure how our system is supposed to work in certain cases. So say, for example, that you have a very high confidence that the patient in question has a migraine attack of some sort, but there is a small fraction of a percentage possibility that the patient also suffers from a stroke or a brain hemorrhage. We can have our customers configure our engine to behave in a specific way in these cases where we can't eliminate the dangerous situation completely. So they decide if they want our engine to tell the patient that you probably have a migraine attack and you should eat your medication and rest, or if they want to take in the patient just to be safe.